Hello everyone, welcome back to Health Issues with Deborah. So the decision to breastfeed your baby is a personal decision and it depends on you, the mother, especially if you don't have any underlying medical condition in quotes. However, in this episode I want to share with you the physical, the emotional and the psychological benefits of breastfeeding for you as the mother. However, this episode is not only for females, so if you are a male, don't go away. Let's learn together so that we can encourage her to breastfeed that baby well. You are welcome once again to Health Issues with Deborah. So in this episode, the topic is the rich benefits of breastfeeding for mothers. The rich benefits of breastfeeding for mothers. I would like to say a big thank you to you all for viewing my previous videos, for commenting, for answering my questions, for the likes, for the comments, for subscribing to my channel. Thank you so much for subscribing to my channel. So let's get to the topic of the day, the rich benefits of breastfeeding. Surprising rich benefits of breastfeeding for mothers. Breastfed mothers have a reduced risk of cancer. Yes, research shows that breastfed mothers have a reduced risk of both premenopausal and postmenopausal breast cancer and ovarian cancer. So whether before menopause or after menopause, breastfed mothers have a reduced risk of developing ovarian cancer and breast cancer compared to their non-breastfeeding counterparts, because breastfeeding suppresses your ovulation, and while your ovulation is suppressed, a woman's lifetime exposure to certain hormones are reduced. An example is estrogen. So while you are breastfeeding, your estrogen level lowers, your estrogen is lessened, and with that the woman has a lesser chance of developing ovarian cancer and breast cancer. So the longer you breastfeed, the lower your chances of developing ovarian cancer and breast cancer. Number 2, breastfed mothers have a reduced risk of type 2 diabetes. Yes, for mothers who don't have the diabetes at all, breastfeeding helps to prevent them, it helps to reduce their risk of developing diabetes. For mothers who have diabetes, breastfeeding helps to improve your insulin sensitivity. So while you are breastfeeding, your insulin sensitivity is improved, and this eventually helps to reduce the severity of the illness. For mothers who develop gestational diabetes during pregnancy, breastfeeding helps you to prevent having type 2 diabetes eventually. Exclusive breastfeeding for at least 6 months, it helps you to prevent having it eventually. And for babies that their mothers are diabetic, breastfeeding helps to protect those children from having diabetes. So breastfeeding is beneficial for the baby and for the mother, especially when it comes to diabetes. Breastfeeding helps to build stronger bones and also protect against osteoporosis. Current studies have found that breastfed mothers are able to return to their bone density, their pre-pregnancy bone density, that is their bone mass before pregnancy. While they are breastfeeding, they are able to return to that bone density or even a higher levels. And at the same time, mothers who breastfeed, they have a lower risk of developing osteoporosis. As a matter of fact, they have a 4 times lower risk of developing osteoporosis compared to their non-breastfeeding counterpart. And osteoporosis is a disease in which the bone becomes brittle, it becomes porous, it becomes weak, and a little bend or twist can break the bone. So eventually in life, breastfed mothers are able to overcome osteoporosis, helps to prevent osteoporosis, and non-breastfed mothers are also more likely to suffer hip fractures eventually in life compared to mothers who breastfeed their babies well. So breastfeed that baby well. Breastfeeding may help to manage pain. So even if you had a cesarean section, research suggests that you breastfeed your baby, that breastfeeding will help you to relieve the pain while you are recovering. So whether you had a normal delivery or you had a cesarean section, breastfeeding could help you to manage pain. Number 5, breastfeeding helps to burn extra calories. Yes, I'm saying this with all excitement because I want to burn calories. I'm a breastfeeding nursing mother. So do you know that a woman's body uses as much as 20 calories for every ounce of milk that is produced, and in a day she might end up using about 600 calories, burning about 600 calories just because of milk production, depending on her milk supply. So with that, if she's able to burn calories like that producing milk, and she's able to ration her meals, she will be able to lose those excess fat that she accumulated during pregnancy. So breastfeeding helps to burn extra calories accumulated during pregnancy. Number 6, every woman needs some time to heal after delivery, and breastfeeding can help to speed up that process. Now, the mother's hormones are suppressed, they are altered during breastfeeding, and this alteration holds back her menstrual cycle, and so with this she doesn't lose blood every month as usual. So this helps her to replenish her iron stores, those iron she has lost during pregnancy. While she's breastfeeding, her iron stores are replenished. She has time to rest, and so those irons that the stores that are lost during pregnancy, she's able to replenish them back. Number 7, breastfeeding can protect your heart. Yes, you heard me right. Research shows that women who breastfed for at least 4 months, exclusive breastfeeding for at least 4 months, had 20 to 30% lower risk for hypertension and heart disease. So while you are breastfeeding, you are reducing your risk of developing hypertension and heart disease. Number 8, breastfeeding helps to protect from multiple sclerosis. Multiple sclerosis is a disease condition that affects the central nervous system of the brain. And for example, Canada has one of the highest rates for multiple sclerosis. Is a self-immune disease. It's an autoimmune disease. Now, according to the American Academy of Neurology, mothers who breastfeed for at least 1 year 4 months, that's 15 months, exclusively for 6 months, then adding other derivatives after this month, eventually 1 year 4 months, these mothers are 53% less likely to suffer multiple sclerosis. Don't forget, it's an autoimmune disease. Okay, now let's go to the next point. Number 9, breastfeeding guarantees less spending. Yes, the financial implication of breastfeeding is worth discussing, especially with this whole economic meltdown. You want to save your family that extra expenses on baby formula. You don't have to panic, oh, where do I get money to buy my baby's formula? Where do I get my baby's preferred formula type? Just feed that baby well and save your family that extra expenses. Going to number 10, with breastfeeding you can live longer. Yes, research shows that for every 597 women who breastfeed their babies exclusively for at least 6 months, then addition of other derivatives making 1 year, out of these 597 women, 1 death is prevented. I know you want to live long just as I want to live long, so breastfeed your baby well, stay alive for your baby and stay alive for your family. Apart from these physical benefits, we also have emotional benefits of breastfeeding. Breastfeeding helps to overcome PPD. PPD is postpartum depression. So it is a mood disorder that is common to women after giving birth, and it is characterized with feelings of sadness, worry, anxiety. Some even lose appetite, sleep disorders, just that feeling down after giving birth. So breastfeeding helps you to overcome postpartum depression. Feed your baby well, have an intimacy with your baby, and with time you overcome postpartum depression. So let's go to the psychological benefits of breastfeeding. So while you are breastfeeding, certain hormones are released. An example is oxytocin and prolactin. For example, now oxytocin is beneficial both for the mother and for the baby. Oxytocin is also called mothering hormone. Oxytocin helps to reduce the stress of the mother. It helps the mother to keep calm. It reduces stress, helps the mother to keep calm, and it fosters that relationship, that love, that bond between the mother and the baby. So while you are breastfeeding, that bond between you and your baby is increased, as you are releasing oxytocin. Number 2, oxytocin helps to shrink your uterus, your womb, back to the pre-pregnancy size. So with oxytocin, your womb is shrinked back to the pre-pregnancy size. Yes, every woman wants that. You want to get back to your shape. So feed that baby well, release oxytocin, and you're able to return back to your uterus is able to return back to the pre-pregnancy size. Number 3, oxytocin is also the key hormone for milk letdown. So it also aids in the production of milk. You want to produce more milk, you want to feed your baby more, oxytocin also aids the production of milk. So let me give you 2 more bonuses for the baby. When you breastfeed your baby, where it improves the skin of your baby. Your baby has a more beautiful skin, all those patchy skins. No. Your baby's skin is beautiful, and your baby's bone development is also improved. You don't have to spend so much on bone problem. The mouth is not well formed. This one is not well formed. When you breastfeed your baby well, all those things are dealt with, they are taken care of. So thank you so much for watching this episode. In my last video, I asked for a question, so that takes us to question of the day, question time. So my question was, what is the name of that milk that the woman secretes immediately after giving birth? The yellow milk, the yellow secretion she feeds the baby with. Somebody got it right. The answer is colostrum. Thank you for answering the question. And my question for today, okay, so what is the name of that process of milk formation? The process whereby a woman produces milk, secretes milk. What's the name of it? It is not breastfeeding. So just go down and leave your answer for me in the comment section. The process of breastfeeding and producing milk. What's the name of that process? Thank you so much for watching this episode. If you are yet to watch my previous videos, please watch them. They are all educative, they are all informative. Thank you so much for watching. If you have not subscribed, please subscribe to this beautiful family, and let's keep learning together. Thank you so much. Stay safe. Bye for now.